Okay, so welcome to today's session webinar on vaccinations, and I'm very pleased to be able to introduce you to some of our local public health, GPs, primary care network representatives and Norfolk County Council quality assurance vaccination planning people. So if I may introduce you, can I introduce Tim Weller first? Tim, did you want to say who you are?
Fantastic, thank you, Christine. So my name's Tim Weller and I'm head of the Integrated Quality Service looking after the commissioned providers in Norfolk and Waveney.
Thanks, Tim. And can I ask Suzanne to introduce herself?
Hello, my name is Suzanne Meredith. I'm Deputy Director of Public Health working at Norfolk County Council.
Thanks, Suzanne. And can I introduce Louise?
Good morning, everybody, and thank you so much for joining this webinar this morning. My name's Dr. Louise Smith. I'm the Director of Public Health here in Norfolk. I'm really pleased you're joining us today to talk about vaccination, and I'm hoping that we'll be able to hear from you, your stories, answer your questions. If we don't get everything covered today, then we can answer things by email, or indeed we can put more sessions together like this.
Thank you very much, Louise. Thank you.
Christine, do you want me to go ahead and say a few words about today's session, or have you more people you wish to introduce first?
I've got a few more people to introduce, and then I'll come back to you, Louise. Thank you. Thank you so much. Irene, do you want to introduce yourself?
Hi, I'm Irene Carews, Quality Improvement Nurse for Norfolk and Waveney.
Thanks, Irene, and I'm so pleased that you're here today as well, because Irene's been out vaccinating people, so she hasn't always been able to attend our Thursday Q&A session, so thanks, Irene. Angela.
Hello everybody, I'm Angela Ward and I'm a project manager working with Norfolk County Council in the vaccine planning team.
Thank you, Angela. I'm really pleased that you could join us at such short notice. Thank you. Hannah.
Hi everybody, I'm Hannah Clark. I'm a project manager working at Norfolk County Council alongside Angela and Tim and Irene and others and Christine to support the rollout of the vaccine.
David.
Hi, good morning everybody. I'm Dr. David Goltzer. I'm clinical advisor to the CCG for care homes.
Thanks, David. Are you able to put your video on, or is it just me that can't see it? You might be one of the screens I can't see, but if you could, that'd be great.
Yeah, no, it's on.
Oh, it is. Oh, it's obviously not on my screen at the moment, so sorry. Oh, we have Dr. Janine Smurl who's joining us. So before I go any further, I really ought to introduce myself as well. I've done something that I've done in the past. I've introduced everybody else and forgotten to introduce myself. So I'm Christine Footer. I'm the Chief Operating Officer of Norfolk and Suffolk Care Support, and we've put this together with all our colleagues across health and social care. So Dr. Janine Smurl, are you able to put your video on and unmute yourself and just introduce yourself?
Hello, I'm Dr. Janine Smurl. I'm a GP and I'm a clinical director for Norwich PCN, so I've been involved with the vaccination programme. Unfortunately, I've got another vaccination related meeting at 10:30, so I'm only going to be with you for a short time. Okay,
well, what we're going to do is we're going to have Louise introduce the session, Louise Smith, the Director of Public Health, and then we'll go straight into questions. And what I would suggest is anybody that's got a question for a GP to put it in the chat box as soon as possible so we can ask you, Janine, whilst you're here. We are recording the session as well, Janine, and if we can't get through all the questions or there are more to ask, we may set up another session at a later date.
That would be great. Thank you.
Thank you. So over to you, Louise.
And thank you, Christine, and thank you everybody for joining us today. You will all be aware of just how exciting it is that the COVID vaccinations are being rolled out across the country. And colleagues such as Janine are working really hard to vaccinate people as fast as we possibly can. We're currently working on the early priority lists, and in that group, people in residential care, in care homes, everybody aged over 50, those with long-term conditions, and health and social care staff are being prioritised. We really wanted to come and join you today to talk things through, because we are concerned that the uptake in staff working in social care is not yet as high as we would very much like it to be. So Suzanne's going to talk you through some general introductory slides about vaccination, but the main purpose of today is to answer your questions. If you have anything that's particularly technical, we may need to take it away and come back with more detail later. I'm really pleased to be here. I am hugely supportive of the vaccination scheme. When I get called, I will have the vaccine myself. And indeed, I'm so committed to getting everybody vaccinated that my husband, who was retired, has been sent out to get a job and is now working for one of the GP practices, supporting running the vaccination centre. And to be honest with you, I'm far more worried about him getting run over in the car park, because he's helping people park their cars, than I am worried about the negative effects of the vaccine. At this point, I'll pause, and I think I'm handing to Suzanne to talk us through some slides and information. And Suzanne, you're still on mute.
Can everyone see the slideshow?
Yes, thank you, Suzanne. It's up. Yeah.
Brilliant. And I'm just going to check that it's going to actually move when I press the return button in a second. I'll just check again. But first of all, I wanted to say thank you again as well for the invitation to join you today. I think it's really good for people to get the chance to talk, to get some information, to get their questions answered. And as Louise said, it's really important for us to hear feedback from others about what their views are and their concerns that they might have. And from a public health point of view, obviously, we're really excited that it's a really important, vaccination is a really important part in our fight against this disease. And I know many of you firsthand have witnessed some of the really severe consequences of COVID, and we're hoping that vaccination will help reduce those. And speaking from a personal point of view, in full disclosure, I have had my vaccine, and I have, therefore, I know exactly what it's like in terms of having it, and also making that decision as well and gathering the information. So I think it's really important. Now, has my slide changed? I just want to check before I move on.
Yes, Suzanne.
Yeah, brilliant, thank you. So, very basics. We know most people in the population, if they catch COVID-19, will experience mild to moderate disease, illness, and will recover without getting special treatment. They'll stay at home and just look after themselves for a few days. But we know from first-hand experience, the people on this call, that older people and those with underlying medical problems are more likely to develop serious illness. And it's these people we're trying to protect with vaccinations. Other risk factors are starting to emerge from COVID. We know people who live in crowded housing conditions, have got high risk jobs and occupations, are part of our Black and minority ethnic populations or are obese. They're also at risk of developing serious complications. And we've seen a lot of cases and a lot of deaths in the UK. So we know over 4 million cases have been reported in the UK. Sadly, over 117,000 deaths last reported. And in Norfolk ourselves, we've seen more than 39,000 cases reported on tests. We know the real figures are much more than that. And very, very sadly, we've seen more than 1,278 deaths in hospital and more than 538 deaths reported in care homes. So this is really serious. And from your experience, you know that although the numbers are dropping in Norfolk, we're still getting new cases and we're still getting new outbreaks. And so we are still needing to fight this infection on all fronts. And so I don't apologise by saying the first slide has got nothing to do with vaccination. It's got to just reiterate the point that vaccination is one thing. We still need to protect ourselves and others by doing all the things we've been doing before. So washing your hands, covering your face, making space, following infection control policies at work and PPE and testing, and getting a test if you've got symptoms. And that's the message we want to make sure everyone still remembers when they're getting their vaccinations as well. But we're obviously very pleased that we've now got vaccination, a major part in preventing serious illness and deaths. We know it is safe and effective. We know it's going to give us the best protection we can possibly have against coronavirus at this stage and reduce our risk of getting seriously ill. But taking a step back a minute, vaccines aren't new, and we know vaccines are just medicines to help prevent infectious diseases. And most of us have, over the range of our lifetime, had a number of other vaccines, childhood immunisations, travel vaccines, and most of us will be getting our flu vaccine every year now. And so things like things that used to be common killers, measles and polio and tetanus and TB, we hardly hear them anymore. They're very rare, but we know that's because we've got vaccines. And so vaccines, from a public health point of view, are a really, really exciting thing to have. There's been a long history of scientific development of vaccines. And when you think about it very, very simply, if people wonder, vaccines aren't anything mysterious, but they feel like they're mysterious when we talk about them. They're just medicines that teach our immune system how to create antibodies to protect us from diseases. And it's much safer to have that vaccine and to let your immune system learn through that, rather than catching the disease itself and then having to treat it. I think our immune systems are fantastic and vaccines are fantastic. It does take a bit of time for our body to build up that protection. So that it's not instantaneous cover. It will take a couple of weeks for us to build those antibodies in our bodies. But one message we need to remember is we can't catch COVID-19 from the vaccine itself. Also, in terms of vaccines, we know that these vaccines can prevent us from getting seriously ill, but it doesn't mean that it stops us from catching the infection. It just means that it's helping us fight the infection once we've caught it. So we don't know at the moment, the science is still working on this in terms of whether we can still spread the infection to others. And I think we're seeing examples where we think we still can spread the infection at the moment when you've had a vaccination. So again, it's really important to have that message that says still keep up with infection control, even if we've all had the vaccination at the moment, because we don't know enough about how we can spread it. We were asked just to mention what are the different vaccines and how do they differ. And most people will know that there are 3 vaccines currently approved for use in the UK, and 2 of them we're using at the moment. So the 3 vaccines, the names are Oxford AstraZeneca, Pfizer BioNTech and Moderna. And the first 2, the Oxford AstraZeneca and the Pfizer BioNTech, are the ones we're using here at the moment in the UK. Now, people want to know what's the best one. And there is no best one. It's really difficult to compare them. The things they've got in common are they are all developed in extensive trials. They've all been proven safe and effective. They all need 2 doses. They're all free on the NHS. The differences are that they've all been developed slightly differently and they used different science to develop them slightly differently. They've all got slightly different levels of effectiveness in different circumstances. They all have got storage differences. They're all stored at different temperatures and there's different rules. And there's different rules when administering them based on their trials. So there are, for example, you'll have heard different minimum ages for each one. People with certain allergies are recommended to take one rather than the other. But there is no best one to take, and so that's why we're using both of them at the moment. Now, people are also concerned about the speed of the vaccine, how quickly it's been taken to develop, and that's one of the reasons why some people are delaying taking up the offer. They're worried that it's been done too quickly, and I think the messages are really important, that the standards for safety and efficacy have been applied the same as any other vaccine that's been rolled out in the UK in the past. And I think the message is that the global emergency has really helped focus minds. It's helped focus investment. It's governments from all over the world have thrown money at this problem to get the development done quickly. And also people have been wonderful volunteers, have been really quick to volunteer to take part in trials. So that some of the barriers that are normally in place that take a lot more time for drugs to be developed, they've actually been wiped out by the fact that we've all been focusing on getting this done as quickly as possible. And the MHRA, the Medicines and Healthcare Products Regulatory Agency in the UK, they are independent regulators. They're not pressured by the government. They are independent, and they can confirm no steps have been missed from the process. The same process has been followed for all vaccines. If we're still concerned about the safety after all that, and we think maybe the trials were too small or whatever, now we've got a real life trial in place in the UK, because basically 15 million people in the UK have now had their first dose of the vaccine, and over 500,000 have had their second dose. So there is a system in place to record any adverse effects that any of those people experience, and that those are all being fed back to the MHRA, who are monitoring it closely. And they have recently, in the last week or so, issued a report that said they still think the vaccines are safe and effective. They've got further reassurance now that they are safe. So the side effects that we know are mild, mainly for most people, and some people don't even get any side effects at all. But the common ones are a sore arm and mild fever, headache and tired and achy. And in my experience, and others on the call may also have experience of theirs, but in my experience, it was a sore arm for me. No serious side effects have been reported. Louise has talked about the rollout process and the rollout list. And we've been asked, why is the rollout process as it is? And we know that the vaccine have been offered first to those at highest risk of either catching the disease or suffering serious consequences of it. So residents in care homes and staff working in care homes were at the top of the list, followed very quickly by all those aged 80 or over, and all frontline health and social care workers. And we know frontline workers are considered to be at high risk of contracting the disease, and that's why they've been included in at the top of the list. But actually the rollout's been going really well in Norfolk and Waveney. A lot of people in all those different age categories that we can see on the screen have come forward. We've got really good high percentages in all the different age groups. We are now on groups 5 and 6, so we're now including people aged 65 and over, and all those who have got clinical complications. But of course, we want to encourage everybody to take up the offer, and we still want some staff to take up the offer as well. My last slide, you'll be pleased to know, sources of reliable information. It's completely sensible to weigh up the risks and to gather the information you need before you make the decision. But we've heard about misinformation circulating on the media, social media and on the internet. We've heard various ridiculous claims and also things that sound a bit plausible, and it's very confusing. And so if people are asking you for information or you want information yourself, we would just say, we would beg, please go to reliable sources of information. And the one to start with is the NHS website, that you can trust that to give the most reliable information. If you also then need someone to help explain it in more detail, of course, ask your healthcare professional, your midwife, your doctor, or the person who's actually offering you the vaccine in the clinic. And my last point would be getting vaccination means protecting yourself from the virus so you can be there for your family and friends and residents. And so from a public health point of view, we strongly recommend that those who can do choose to do so. That's me finished, Christine. I will hand back and share my screen if that's okay.
Yes, thank you very, very much indeed, Suzanne. Thank you. And that's a great introduction to the session. We have already got some questions in the chat box, and Janine, I'm going to bring you in because I know Irene's put some information back in here, but it would be remiss of us if we didn't go to a female GP to ask the questions that are in there, which one was, thinking of having a baby, this person was COVID positive in the past 28 days. Is it now possible to have the vaccine as they're concerned about the fertility? That was from Marie. Or was that Victoria? I can't remember, Marie. And then Victoria, going through fertility, is this member of staff, would the vaccination have an effect on her or her fetus in any way? So, Janine, are you able to come in?
Hello, I've had the same question asked many times because we've been into quite a lot of care homes to vaccinate, and I've had this discussion with quite a lot of staff at the care home and also at the vaccination centre. It's quite a common question. So what I want to say is that as far as we've been categorically told that neither of the vaccines would affect anybody trying to become pregnant who's not pregnant. I know vaccinations are never actually, well, when they do research into a cohort of people to vaccinate them, they don't choose pregnant people to actually test a vaccine on, but we do know that from all other vaccinations that vaccinations are safe, but it's just not ethical to test it in people who are currently pregnant. But it would not affect you in any sense, in any way, trying to become pregnant. It just produces, it's a sort of a part of a dead virus that allows you to mount an immunity against this particular virus, and then it's gone, so that it wouldn't affect your fertility. To me, I would be much more concerned if I caught COVID while I was pregnant. So you may have seen, because that is an unknown, and if you looked back at a couple of years ago where there was the Zika virus that was affecting people in South America, and the babies were affected, they had microcephaly. We have no idea what would happen to people who have COVID and during their pregnancy, and how that might affect their fetus and their developing baby. The other thing is, if you actually develop COVID and you can become more unwell while you're pregnant, because your immunity is different. Your BMI would be higher, and you may then be hospitalized. You may then become very unwell, and then the choices of how to treat you would be different because you are pregnant. All the drugs that we want to use, they may not be able to use. If you got COVID and then develop long COVID as a pregnant while you're pregnant, or a young mother, we don't know whether long COVID may be more common in people who are pregnant because their immune system is different. So I would be, if I was planning to get pregnant, I would try and get my vaccination done. With people who are, if you've had COVID and you're 28 days past your diagnosis, that is a good time to actually get your vaccination. And if you could get your first vaccine in before you're pregnant, then at least there'll be some immunity. But then if you become pregnant for your second vaccine, I would then certainly speak to your GP to try and weigh up the risks of having the second vaccine while you're actually pregnant. So that would be my advice. Does that cover it?
I think so, Janine. Can I just ask Marie or Victoria, do you want to come in, or just ask a supplementary question, or is that okay? Just unmute yourself and just say what you feel.
That's lovely. Thank you very much.
Is that Marie or is that Victoria? I couldn't see there.
Victoria.
Oh, Victoria, thank you, Victoria. That's brilliant. And is Marie about? Marie Ricks? Oh, she's written here. Yes, that's very helpful. Thank you.
Okay.
That's great. So thank you very much, Janine. That's really helpful. I'm going to open it up now to anybody else that wants to ask a question. So if people want to put their hands up and come in, that would be great. If I don't have somebody immediately, I do know that Lindsay had some questions at the very beginning. Lindsay, whilst I'm waiting for people to put their hands up or put, you know, a message in the chat box, did you want to come in, Lindsay, and ask a question?
Yeah, hello. Thank you very much for all the hard work you've all been doing. We really, really do appreciate it. I'm a care home owner, and it has been brilliant. I was asked on Christmas Eve to produce a Excel spreadsheet with all my staff data on for the potential of us all having our vaccines. I duly did that. New Year's Eve, I was then phoned by the QEH hub to say that the vaccines were in and we were all being called forward, and we were very grateful for that. However, they were unable to open up the Excel spreadsheet that I had produced prior to that. I went through all my staff verbally with the lady at the vaccination hub. We were then asked to come forward. The next day, all my staff were vaccinated. However, 7 weeks later, I received a telephone call from my GP surgery on Saturday morning, calling me forward for my vaccination. And I actually at the time thought it was for my second dose. But then I queried with my GP surgery, if it was my second dose, how would they know all of my other staff for their second dose? And it became apparent, no, it wasn't my second dose. They were calling me through for my first dose. I was then concerned because it hadn't been registered on my private medical documents that I'd had the vaccine. Would they then be calling my other staff forward? They would then take the appointment that was given, go to Manor Farm Medical Centre where the appointments were being made for. They would get there, they would then be told, no, it's your first dose. So that would waste their time, waste the vaccinator's time, waste the potential of the vaccine. Also, I was then concerned, have they actually, because I did this all verbally, have they actually got my data on record, and how will I know that we will then be called forward in 12 weeks to have the second dose? My then thoughts were going through, if we are then being called forward to go to Manor Farm Medical Centre instead of the QEH hub, will we be given two different types of vaccine? We had Pfizer at the QEH hub, and I know they're giving out the AstraZeneca at the Manor Farm Medical Centre. And how will that then be, will the efficacy of having two different types of vaccine be safe? Have
Thanks. No, that's
I don't
fine.
sound negative, but I do have concerns about the data being transferred to my GP and my staff's GPs.
Yeah.
And also, is it safe to administer two separate makes of doses?
So
should
yeah,
we be called forward to somewhere else?
Thank you, Lindsay. So we've got two questions here. I can answer the first one because I raised it today at the operational delivery group. That meets every morning, 8:30 to 9:30, to discuss the planning of the vaccination delivery. I raised this query at the very beginning when people were being called, particularly to the Queen Elizabeth hub. They did not have systems in place that aligned with other systems, and everything was being put through by hand and wasn't linked to any other systems. What you've identified is an issue in the system at the Queen Elizabeth. They've got lists of people that do not appear on the NIVS, the National Immunisation and Vaccination site, which they are now having to put in by hand. So what they will do, Lindsay, is they will come back to you, identify your staff and put them through the systems that will then link across to GPs as well. So at the moment, there are a cohort of staff that have not been recorded at the Queen Elizabeth. They are going back and they are putting all of that in the system. But what you did do was raise an issue with that hospital and the recording of data. It is not prevalent across the rest of the county. It's not the same with the Norfolk and Norwich, and it's not the same with the James Paget. It's specific, we understand, the Queen Elizabeth. So that's the first thing. The second point is about your second vaccination. And I also raise this point, but I'll let the GPs talk about it in greater detail. But I was told that there's been no decision made at the moment about mixing vaccines. However, next week on Tuesday, NHE and I will be making a decision about that. So that's the information I've been given. Janine, did you want to come in here?
Hello, yes. I've got first experience of all of these issues, having had to go and deliver the vaccine in a hurry, especially in care homes, because the deadline was brought forward. The deadline was brought forward in order for us to vaccinate the care homes and the staff as quickly as possible because of the pandemic actually really hotting up at that point, and it has already made a difference. But it is a complete mess, I'm afraid, because we've been targeting the same groups of people. So we have been saying to care homes, ring this number, go get your staff vaccinated, at the same time as saying we're coming in next Tuesday, bring in as many staff as you can, and we are producing lists and sending them to the hospital centres, because they're trying to use up the vaccine in a hurry. Because when you get the Pfizer vaccine, once it's been defrosted, it has to be used within 2 days. So you have to fill the clinics. So I can only apologise that this is what's going on, but it's because 2 or 3 groups of people are trying to go at it full pelt to vaccinate people fast. What I can assure you is that within a few days, wherever someone has a vaccine, it then ends up in the GP's records, but there is a lag. It goes onto a system, on a computer system, for example, with primary care. It goes into something called Pinnacle. We put it on, 2 or 3 days later, it appears into the GP system. So for second doses, the GPs should know, because every single time we put a patient on Pinnacle to vaccinate them, we verify who the GP practice is. So it goes into the right records. So hoping that in 8 or 10 weeks time from the first vaccine, the GP will be able to help by saying you have had a vaccine, you're now due. Currently, you have to open something to actually see whether it was Pfizer or AstraZeneca, but it's on there. It's on the record whether it's Pfizer or AstraZeneca. So it's not automatic. So it comes up saying first dose given. It doesn't come up saying first dose given AstraZeneca. And we've told every single person that we've vaccinated, please make sure that your second vaccine is the same. So I'm hoping that the staff will have a little card which says on it whether it's Pfizer or AstraZeneca, so that they can have the same vaccine a second time. We are recommending people have the same vaccine again, but I'm also aware of a research that is happening at the moment, where they're giving patients 1 dose of Pfizer followed by a dose of AstraZeneca, and also there's research going on where they're giving them a first dose of AstraZeneca and a second dose of Pfizer. But this is totally it's in research now. It's not something that's done, but they reckon it's possible that you may get better immunity having had the 2, but it's not something that we're going to recommend in any sense or form. But people shouldn't be worried about that, I don't think. And there was one more question to do with if we're worried, should we vaccinate people sooner in care homes? The answer to that would be no, because they've actually showed that with the AstraZeneca, that if you're nearer the 12 weeks, you get better long-lasting immunity.
Thank you, Janine. I think the issue, though, that Lindsay was raising, and you're absolutely right about the recording and difficulties with recording, there is a specific issue with the Queen Elizabeth about it not actually having gone on any.
Really?
No. So we are dealing with that. It is different because that's 7 weeks since Lindsay's staff were vaccinated at the Queen Elizabeth. It is not on the system. It is an issue and it is being dealt with. But your points around the second vaccine, though, are very helpful. And as I say, today at the call, I was advised that the NHSE and I will be talking about mixing vaccines next Tuesday. But until that point, we don't know what they're going to say. So the advice is same vaccine. And Lindsay, for your reassurance, the Queen Elizabeth have said that your staff will receive the Pfizer vaccination, so for the second dose. So they will be in touch with you and they will resolve that issue directly with you, Lindsay.
Thank you very much.
Louise, that's a pleasure, Lindsay. Louise, do come in.
Thank you, and thank you for that information about the data flows. It does sound like we need to follow that one up behind the scenes. I just wanted to re-emphasize what Janine was saying about the safety of the vaccine. So the plan is that people will be offered their second dose in the same place that they had their first dose, and that they'll be offered the same vaccine as they had before. But it's not something to get very worried about. That there is no reason why, if somebody were inadvertently given the 2 vaccines rather than 2 doses of one, there is no reason why that should cause a problem. And similarly, if somebody receives an extra dose of a vaccine, it doesn't cause a problem. It's not a dangerous thing. So whilst obviously we will do everything we can to run the system efficiently and in the way that it should be run, it wouldn't be severely dangerous for somebody if they ended up getting something that wasn't intended.
Thank you, Louise. We've got somebody's got their hands up and we've got some questions in the chat box. So I'm going to bring in some people first and then I'm going to go to the chat box as well. Angela, sorry, did you want to come in? Was this in relation to one of the questions that's just been asked, Angela?
Yeah, I just wanted to talk about where you've highlighted about the QEH. I just wanted to tell you about what Norfolk County Council have been doing. Just to put some assurances forward in regards to the data transmissions and stuff like that, because we, Norfolk County Council developed a process whereby we are looking at the cohort 2 in particular, and they, Norfolk County Council are sort of coordinating the approach of having the invitations sent out to individuals to get their vaccine. So we're talking to providers, and we have been talking to providers, and the workbooks that was it Lindsay was talking about, where she had to sort of ring up and manually do that with somebody. We have a process in place where people are actually sending that back to Norfolk County Council into the vaccine planning team. It's then being extracted out into the acutes and into the community settings, and we're able now to follow the patient and follow where that person is being referred to, the date they're being referred, and we also have details of how they can then follow up, you know, from the referral site to ask the questions about when is my vaccine happening, I haven't received anything. So we are working with those processes to tighten them up, and I just wanted to give that assurance that, you know, people's data is safe and we can follow a flow.
Thanks, Angela. And this was definitely at the very beginning of the process, and things have changed as you've explained, Angela. But this was a real problem at the beginning, and I know that it has been really tightened up. So thank you for that. I'm going to bring in.
You're on mute, Christine.
Sorry, yes, I've just realised, just as I was going to ask Tracy to come in. Tracy Butterworth, are you there? Do you want to come in?
I am, yeah.
Lovely, Tracy. What's your question?
I didn't have a question. Sorry.
Oh, you had your hand up. Or maybe, yeah, you got your hand up. No worry. It's lovely to speak to you anyway, Tracy. Did you have a question?
I haven't at the moment, no.
Okay then, Tracy. Okay, no problem. I have got a question in the chat box, which I thought was quite an interesting one. It's about the second vaccine. Here we are. Tom, did you want to come in? Tom Lyons, given the concern about low uptake, surely we should also be focusing on second vaccines of residents in a quicker time frame. Tom.
Morning, Christine.
Morning.
I think this actually was just answered by Janine in passing, that actually the efficacy is pretty good up until the 12 weeks anyway. Obviously the data does show that after the second vaccine it is a higher one, or certainly that's what's being publicised elsewhere. So the question I had really was, if we are worried about the uptake of our staff, and I think we're sitting somewhere between 75 and 80% of our staff wanting to be vaccinated, but should we not be focusing some of our resource into getting our residents double vaccinated, certainly with those either Pfizer or AstraZeneca? That was really my question. Thank you.
Thanks, Tom. Shall we go to Louise? Louise, would you like to answer that?
So Tom, I think you've kind of answered the first bit of your question as you were answering, and as Janine has said, the evidence is good that the efficacy or effectiveness of the vaccine is strong with that 12-week interval. And of course, as you know, what we're trying to do is balance some people having had 2 doses against everybody having had their first dose, and the evidence and the modelling is showing that the more people who've had the first dose, the more effect we'll have to prevent COVID across the whole community. You said that about 75% of your staff are looking to have the vaccine. Are you able to feed back to us the reasons why that other 25% have not yet decided to have vaccination?
Yes, no, I think we've certainly come up against it with the BAME community has been the biggest concern, and younger females of childbearing age in particular are the two major cohorts. We were also seeing a lot of people that were that found the whole booking and actually getting the vaccines quite difficult, and certainly the locations of the vaccination sites. That's obviously changed in the recent weeks in terms of being able to book through the national portals, but they're really the main reasons. That, and as I'm sure every provider has got some of the non-believers or the people that just don't want to be vaccinated. So, and also when I say 75%, it is going to be sort of 80, just over, but some of them can't actually have the vaccinations just yet, but due to being within 28 days of testing positive.
Yeah. So what do you think that we should be doing to help you mop up those that are not? Obviously, as you say, the people who can't have the vaccine, there's people who have a very strong view, we're unlikely to change their mind, but there's a big group in the middle where it's just not quite working for them yet. What do you think the things that we could do to help you would be?
That's a difficult one. Certainly we found that when we are having the resident vaccinations on site, that the uptake was significantly more than when we're having to ask our staff to go onto a portal which inadvertently crashes, or they're unable to get the bookings, and that's certainly been an area of concern for us. It's just making it as easy as possible, and I know that we have got some GP surgeries that are doing sort of rolling booking in systems, but I think that having that option makes it so much easier for us to access it, and just being able to phone up our local GP surgery linked to our care home and be able to say, I've got this member of staff that's on shift, can they come down and get a vaccination? It's just making it as easy as possible for our staff. That's really the absolute key, because they just don't want to travel, can't travel, and they're just not into going on the internet constantly trying to get a booking place. I mean, we've got some that will wait till midnight and try and get on then, but it's not always the way.
Thank you so much, Tom, and that absolutely replicates the information I've been feeding back, as you know, to the groups. That is, actually, if GPs were able to vaccinate the residents and staff at the care homes at the same time, the take up with staff is so much higher than when they are directing them to hubs. It's as simple as that. Janine, would you like to speak? Oh, Janine, you're on mute now.
Oh, I know.
Yeah,
I put my hand down but didn't unmute myself. So again, the answer to the same question again. So the first part was they have actually shown in research that if with the AstraZeneca vaccine, that longer the gap between the two, better immunity you get in the longer term. Is that all right? Is that right, Louise? Yeah. So they actually did that. So they actually vaccinated people 2 weeks apart, 3 weeks apart, 4 weeks apart, etc., up to the 12 weeks. And if you do have your booster nearer the 12 weeks, you get better immunity for the following few months. So it isn't only just the fact that we're trying to get as many people vaccinated with the first doses. That is one of the points, but the second point was that one. The other one is I really do understand it's so difficult for staff to book in for themselves, because a lot of them aren't registered with Norwich GPs or whatever. They don't necessarily work near where they live, and I'd be really happy for us to go back into care homes again to vaccinate. But also the other thing is there's another opportunity when we go in to give the second doses to our residents to give the first doses as well to the care home staff. And again, if we say there's a list of this many people who would like to talk to you, but they're uncertain, then we could actually then be prepared to have those conversations with them at the time. And I think because they know the GP comes in and out of the care home, I am trying to get more of own GPs go into own care homes rather than PCN staff or people that they don't know. So I'm really trying to facilitate that that as well.
Janine, that's really, really helpful. Thank you. And we have had feedback around the Norwich GPs in particular that have been extremely supportive of their care homes in that area. So thank you. I have got a...
The AstraZeneca though, it's when we go into a care home, it's AstraZeneca. So we can't give second doses of Pfizer, for example, when we come to visit for AstraZeneca.
Thank you very much, Janine. Can I bring in Eugene, who's been quietly sitting there with his hand up? Eugene, I had to mute you because I kept on getting a bit of feedback. So if you could unmute yourself and come in, that would be fantastic. Thank you.
Thank you very much. I just wanted to pick up on the point around staffing. We've had some concerns raised by some families around those staff that haven't been vaccinated, and in light of some of the homes having COVID, and the question that we're being asked as providers is, what is it that we're going to do to those staff that aren't vaccinated, looking after those vulnerable residents that, you know, in most homes now are vaccinated in terms of 100% of our residents have been obviously vaccinated, but we still have the minority of staff that aren't vaccinated or are sort of like not wanting to have the vaccine. Is there any advice in terms of what Norfolk can give providers in terms of those relatives that are showing some obviously some concerns around staff working in care homes without the vaccination?
It's a really good point, Eugene. Tim Weller, can I bring you in, Tim?
I had a feeling you were going to ask me that one, Christine.
Yes.
And Eugene, it is a really, really valid question, and I know that it will apply to a lot of providers where they've got staff that are declining. Somebody else is having a conversation there.
Sorry, can you please make sure that you've muted yourself? Okay.
So we are doing a piece of work to try to encourage those staff, and so we're asking providers. We've got some examples of some providers who've been really proactive in supporting their staff with information. So some of the stuff that we've been talking about today earlier on in this forum has been part of that. So if you've got staff that are resisting because they're concerned about side effects, or if they're concerned that Bill Gates is going to be watching them, or that they're going to be setting off alarms when they go into Tesco, all of these sorts of things, we're the myth busting stuff that we're doing, we're sharing with providers, and we'll do more of that, but more particularly working with groups. So we're talking about, so Tom mentioned earlier, Black and minority ethnic groups. We've also identified maybe cultural groups outside of ethnicity groups who may be more resistant than others in terms of their uptake of the vaccination. And we're doing some work to identify who those groups are, to make information more accessible for people whose first language may not be English, for example, who might feel excluded from some of the information that's out there for the rest of us. So to make the stuff that's already out there accessible is another big piece. So we've got there's some other colleagues on the call who we meet with regularly to work out exactly where the pinch points are. And it'll be good for providers to feed back to us as well where they think, and we wanted to use this forum to do that, to be really specific about what it is when you're having your discussions with your staff that's actually making them resistant. You know, we really don't want people to feel under obligation to have the vaccine, because it isn't mandated. It's really clear. It's not mandated that people have it, but we want to encourage people to have it because of all the positive health benefits that Suzanne and others have talked about earlier on. So there's a big piece of work going on. We do want your feedback to help us to scope what we need to do to support it better and to make information available, and we'll communicate that widely. We've already started doing it, and we'll put some links together to show you where we've got that information on our website and other places. But it is very much in development as well. So we do need to hear from you and other providers as well about where the particular pinch points are.
Thank you, Tim. Thank you. I hope that's of some help, Eugene. Anyway, but it is a query that has been that is arising. Around care staff, should it be part of their contract, etc. So it's coming up quite a bit.
Let's ask another question. Sorry.
Yes, of course, Eugene. Yeah, please do.
I just wanted to obviously follow up on that. Is that we've had some of our residents vaccinated, but we haven't had any batch codes or anything like that left in the homes. How can we get this information, or what is the process? Because obviously, in terms of audit trail and recording, we should have the information about the type of batch numbers that the vaccine came from, but we haven't had that left in the homes. What can we do about that?
I don't know, Janine, are you able to answer that one?
Yes. Well, when we went to vaccinate the homes, we took the little cards with us, and we did leave a card per resident with the batch number. It is on the Pinnacle letter. So when it goes into the GP letter records, it's in there. So perhaps you could ask your local GP to just print off the notifications from Pinnacle and bring them to you when they come for one of the care home rounds, or send them on to you, but they're all on there.
All right, yeah, thank you. Yeah, because I know of about 5 care homes in the Norfolk area that haven't got that information that I've requested, and they didn't have anything left for them when the vaccination took place.
Okay, that's good feedback. Thank you.
Thank you, Eugene. Thank you for raising that. There's a question in the chat box about could people be vaccinated, inpatients be vaccinated from acute hospitals before returning home. Irene, did you want to take that up? I think there was a question from Steve. Steve, did you want to come in?
But unfortunately I got the wrong ones.
Yeah, it was from me. Yeah, because like everybody else has been saying, it's very problematic to send staff to be vaccinated. We have tried, Tim, to persuade people, but they are set in their ways. As far as making them, putting it in the contracts, already been clearly described on the news that that's not got to happen, because you can't legislate against people's bodies and human rights. At the end of the day, there's not much we can do. And if the families want to take it further with any home, then tell them to communicate with CQC and see if they have an opinion on it, because they've also said in their last newsletter that if any home does a blanket ban when they've not got an outbreak, they're going to be up for an inspection, which I find quite threatening and unreasonable.
Yeah. Steve, I can understand what you're saying there, particularly around those HR contracts. It is a really difficult issue. I really wanted to pick up about the vaccinations from people in hospitals as well. That you
question.
Yeah, I think that's a really useful.
Should be vaccinated. It's so much more convenient for us if they're done before they leave the hospital.
Louise, did you want to come in there?
I was going to pick up on the difficult position that Steve's describing about not being able to require people to be vaccinated, but the worries that residents have. I do believe that this kind of work that we're doing now about trying to understand why people don't want to be vaccinated is the right way for us to be going about this. I can understand why it feels threatening to have the suggestion of CQC suggested, and I can't quite see that one being a runner. But I do have to say I am hearing quite a bit of conversation about whether vaccination could become an occupational requirement for staff, and there are a lot of precedents for that in other parts of health and social care. So doctors, for example, will be required for certain jobs to have certain vaccinations. Steve, yeah, as Tim has said, hepatitis B is a really good example. Steve, I wonder if you could come back and say, you know, what would help you as providers and working to understand and encourage staff to be vaccinated, because we don't want to escalate this into regulations and enforcement, but we do want to try to get as many people vaccinated as possible, and we can't just say it's up to them and we're not going to have any more conversation.
We all know the reasons why. Some of them are saying they may have when there's further developments of the vaccines after a while. It is taken a dim view by our families, and we have an accountability to those residents and families. We couldn't even pick and choose staff on the basis of if they've had the jab or not anyway, because it's so hard. Not only has it historically been difficult to get care staff, we've now got a situation where if you work in a care home, especially if you're, say, over 40, you could be at risk of contracting the virus and being ill. So that makes it even worse. And I'm old enough to remember when the last of the fever hospitals closed, and when it was all isolated, and for homes to be having isolation, if they do start being asked to take people in that are positive, you've got to find somehow a way of keeping them separate from other residents, and it's their homes and their rooms are their homes, and that's very difficult for us in the private homes to exercise. But I mean, you can't, can you? I mean, you have to have injections if you go on certain places on holiday. I can't say I'd like to be a nurse because I haven't got a nursing qualification. I have to have one. there are areas where it could be that they have to have it as part of a job, like a qualification, perhaps. It depends how concrete the evidence is, because we have to say that the guidelines change every day nearly, and when you ring anyone, they don't know, and that's not easy.
Thanks, Steve. Thank you. I've got David and Janine that want to come in. So David, can I pull you in first?
Well, it was a question really to Steve and perhaps other care providers here as well, in that clearly, I mean, what people hear on social media through friends and family influencing decision making about vaccine hesitancy and whether they're going to have the vaccine. So I wonder what can we do to really tackle these people? Can there be a more personal approach to groups within your care home?
If
to report them and tackle each concern one by one.
If our staff could hear what Jeannie said about if you're pregnant and you get the virus, it could work the other way around and you put your pregnancy at risk. If this is being recorded, we could then put that on the screens in the staff room and let it play so people can hear from you, local people, local professionals, not just on BBC News, etc. And what Jeannie said was very, very reassuring, because my experience has been most of our local girls at the 3 homes, they're more preoccupied with pregnancy, and our friends from abroad, they're more preoccupied with the urgency and the speed, and from a historical point of view, they are a little bit averse to taking injections, because in some of those countries they were injected first and asked questions later, and they weren't too preoccupied whether they dropped dead or not. So you can see their fear. They are very deeply suspicious as a culture of being having it, and I've even heard that some of the, not in Norfolk but other parts of the country, that some on religious grounds, it's because it may have meat material in it that they shouldn't be having.
Which I think's been answered, hasn't it, David, on the chat? Yeah.
But I think people really need the opportunity to hear, to listen to explanations for those concerns. It's a question of how that can be done, because I think all of these questions can be very reasonably answered, and I hope people can be reassured on each of those areas you've just mentioned. Actually,
well, we could have a Teams meeting, David, and you could be our guest. I'll put in front of you.
No, I'd be happy to.
Good luck with that.
Yeah, Steve, we did actually invite staff to this session as well. If we put on another session, if you want your staff to attend, then please put them on, because that's exactly what we're talking about, which is being able to speak to the experts. So you're very welcome to invite your staff to one of these sessions if we put one on again. Yeah, lovely.
Invite them to sit and in front of a laptop, and they can participate and watch. And we can involve those that have not had the jab. And if they refuse to come in, then that's fair enough. We've just done something.
You've done everything you can.
Got the evidence, and we can tell the families in CQC and safeguarding that we've done the best we can.
Well, we have really good news in the chat box here. Louise has said that she'd be very happy to come to more sessions, and I'm sure GPs would too. Janine, did you want to come in?
Yeah, I wanted to come in because older people, when they are vaccinated, they may not have the same strong immune response as some of the younger people. So we're saying that after people have had a course of vaccination, they are 70% covered. So you have 3 in 10 people still who are going to be vulnerable. So what I would like a message to the care staff, that 3 out of 10 of your residents are still vulnerable to COVID. So if you do get COVID and you bring it in, so if they may just think, okay, all the residents are covered, so I'm okay, so I won't give it to them. But they could, because some of those residents will not be immune. The other thing is that we're not at this point going to be immunizing any children, so it's going to continue in children and younger people, and care staff are more likely to have young families and still continue to be exposed to COVID and still continue to bring it in to work with them. I know it's a bit of a kind of a guilt thing, but I'd hate it if I was the person who brought in COVID and one of the residents that I'm caring for caught COVID and actually demised. So it's just one of those things that I think when you put it that way, in the sense that they are protecting themselves to some extent, but they really are protecting the residents, and they really are protecting the 30% who are not going to get a full response to the vaccine. And then I could also answer you the question about why don't they get the vaccine in hospital. In the hospital setting, they are being given the Pfizer vaccine. They've got the freezers, they'll be given the Pfizer vaccine. The Pfizer vaccine can't be moved around. It can't be taken from ward to ward to ward because it becomes ineffective. And it also makes it very difficult for us to give the second dose, because a lot of people who are in hospital could be very unwell and housebound, and we can't take Pfizer to them to give the second dose of Pfizer. So that's probably one of the reasons, the practicalities of it.
Well, it's very difficult to get Fakenham Medical Centre that does have Pfizer to attend the home for 1 or 2 people. That's almost like they can't.
They can't.
So how did they get vaccinated?
This vaccine,
they have the
AstraZeneca.
Yeah, but they can't come for 1 or 2. We've had this pointed out to us several times. We've had, here's thinking out of the box, we've had district nurses coming in to do PSA jabs for prostate, nothing to do whatsoever with this. They have been trained on COVID jabs, and they are based at the same medical centre, but it's different budgets, and they can't do it. Now, wouldn't it be good if the nurse had a couple of Oxfords tucked in her handbag that she could do that person that came from the hospital and then get the jab done? That is too clever by half, isn't it?
Yeah, Steve, I think that would be brilliant. And I think that we will get to that. But our NHS colleagues are under really heavy pressure at the moment to use absolutely every dose. So
I absolutely understand that, and I totally agree. Now, here's another question for you guys. Most of our residents have had the virus. Now, my understanding is that there is some resistance if they've had the virus and they've survived. And that's for about 5 odd months. Then if they have the vaccination as well, that's further protection. So we are COVID clear at all the homes, and we are helping the hospitals out, because my brother was in the QE for 16 nights on oxygen. So he's all right now, and but I understand those beds are needed for anybody who has got good prospects, if they have their treatments, of surviving and living a good life for some 10, 20, 30 years. And they've got young families and all sorts, and they're being held up by dogma. And we want to get those beds emptied out of the hospitals and support you guys. But we do need a bit of love from safeguarding and CQC, because what we're doing is quite unusual. We are acting as a community resource, but we're still expected to be of outstanding quality. And that's not easy when we have this sort of thing, because I can assure you, trying to get hold of people on the telephone takes up something like 35–40% of the care time. And people don't respond to their emails, and they organise their boxes so that if they get full, they're not even replied to now. So we're no further forward.
Steve, can I just move us on a little bit, because I absolutely take your point, and you know, everything that you've raised is absolutely valid. But Janine, do you want to come in, and then can I just ask for some final questions from the rest of the group as well? So Janine, come in please, and answer some of Steve's.
Okay, so the thing about district nurses giving vaccines, having one in their bag, that will hopefully happen when they produce the vaccine in single doses. Currently, they're providing them in a multi-dose. So basically, they'll give you a vial, and that in that vial there are 11 doses of vaccine. And once you've started to use it, you have to you've got limited number of hours of using it, and if you take it from house to house to house, it can become contaminated because it doesn't have any preservative within it. So so as soon as we can get it, so it looks like a flu shot, we will give it out like a flu shot. But right now we're not able to
what about
do that.
What about converting an ambulance so that we can protect that and go around that like a library van?
Oh no, we're doing all sorts of things like this. We're doing that for people who are homeless. We're doing pop-up clinics. We've got an SOS bus. We're going to go around. So no, that this is all happening. Really good ideas that are But we're trying to do everything that we can to do it that way.
Well, we've even offered to take residents down to the surgery, and they won't do that either.
Okay.
I think we'll pick up the individual issues, Steve. You know, with you directly. But Louise, did you want to come in here at all? You know, to talk about this delivery model.
I think Janine's explained it really well. We're absolutely committed to, as soon as we get the ability to do it, being able to have people carrying small supplies of vaccine and doing it opportunistically. Stephen, I think outside of here, why don't we follow up that issue about the link between your residents and your local GP? You know, if you're offering to take people to the surgery, let's just follow up that conversation.
Well, that time's been and gone now, but I'm not complaining. I'm just trying to be open and candid and telling you how it is for us.
Yeah, and we're not taking you as complaining. It's you know, we hear a lot in the media about vaccine hesitancy and people not wanting the vaccine. But actually, a lot of the barriers are these really practical ones that people have been bringing up today. That they're equally important.
Yeah.
Yeah. Thank you, Steve. Thank you. Is there any other questions from anyone else? I've noticed. I think we've answered everything in the chat box. But can I just ask, Lindsay? You said you had quite a few questions. I don't want to miss out anything. If you want to come back in, Lindsay, have you got any other questions at all?
No, because all of the questions that I was going to ask have been adequately answered.
Oh, perfect. Thank you, Lindsay, and thank you to your dog there as well. That's very helpful. So obviously very pleased too. Excellent. Yeah. Okay, can I throw it out to everybody else then? Because this is your chance to ask any questions you like. There is no such thing as a stupid question. Please use this time to ask any questions you have at all. It is your time. Do come in. Somebody unmute and come in if you've got any other questions. I know, Steve, you've probably got more questions, haven't you?
No, I'm not going to rise to it. I just think
if you do, Steve, then do come in whilst there is a lull.
Well, we have had 8 admissions already, and so we're clearing some beds, which is very rewarding, very satisfying.
That is excellent news, Steve, because I've followed you all through, all through the beginning issues, and now you've got admissions. It is a step forward, so I'm really pleased
about that, Christine. We've opened 9 homes completely empty.
Oh yes, I know, but you were particularly interested in unblocking barriers, and you've done that. So
a lot of private inquiries have dried up because people are working at home with mum in the corner.
Yes, that's true. That's very true. I tell you what about our experts here? Is there anything you'd like to mention to the group that's here, given that they are social care providers, often managers, but there may be a few staff. We did open it up to staff, but there may be a few staff here. Any other sort of comments that you'd like to make to them around the vaccination? Anyone? Yes, go on, David. Oh, please unmute, because you've got such a lovely voice.
No, the two. Well, I think just to emphasise the point that really the group of care staff who are not getting vaccinated are often overrepresented by the BAME group, and perhaps including kind of Eastern European workers. And those groups are particularly prone to adverse consequences of getting COVID themselves, and generally they are subject to, health disadvantages and inequality. So I think it's a responsibility for both ourselves, but also care home providers, to really do what we can to support those members of staff to get vaccinated. And so I think it's important to really be sure why staff aren't getting vaccinated, and to ask what can be done to try and support those people to overcome their fears and concerns. So please, I think all providers really think about what we can all do to support these people who need our help and support. And sorry about the noise, I've got a bit of work going on in the house.
I thought there was something going on in the background there, David, but thank you. Yes, and it is a plea, and I do know as well that there is some work going on around contacting various parts of the community. So there are groups. There is a group within the Sustainable Transformation Partnership that is looking about how we can communicate with specific groups, those marginalised groups. So there is, isn't there, David? There's some work going on around that.
Going on at the moment, looking into this. But I think the contribution of the care homes themselves into this would be really extremely helpful to understand what's going on. I mean, Tom mentioned up to 25% of staff, but there are care homes with 30% of staff who are not being vaccinated at the moment, which is worrying, as Janine said, worrying not just themselves, but for the care homes and the residents themselves.
Yes, thank you, David. And I have noticed another question that's come in the chat box, which I'd like to take up, and that is from Christine from Involve. Christine, did you want to come in?
Hello.
Hello, Christine.
Hello. Yeah, hello. I just wanted to say thank you, really. Several sessions ago, I asked about testing and jabs and things for our staff, and the answer was all a bit, oh dear, well, you're not quite there yet, you're not on the lit yet. Since then, I have to say, however the wheels turn, all of our staff have now had their first jab. They've all booked for their second one. That's all happening at the QE, and the process for that has been okay. We're in a process now for starting some testing regularly for the staff. My question really going on from that is whether there's any progress on testing for our service users as they start to come back now to face-to-face service. That would just complete a loop for us. You know, we've got so much stuff in place now for infection control and all of that. If we could have some regular tests for that, that would just be the icing on the cake, really.
Well, I can report to you, Christine, that you will be getting tests for your people that attend your day services. That's been agreed.
Fantastic.
That has been agreed. So if you haven't received a letter yet, I will take that up and ensure that you do get one. But there is and it has been agreed that you will get tests for people attending day centres. That has been agreed.
Yeah, that's brilliant. That's brilliant. Thank you very much. Yeah,
that's a pleasure. Can I bring in Irene and then Lindsay?
Hi, Christine.
Hi.
Well, hi. I just wanted to emphasise the point, kind of adding to what David had said. Vaccinating, I've been vaccinated within the PCNs, priority group 1 down, and at the weekend we started vaccinating, or I was vaccinating the clinical high risk group, the vulnerable group, and most of them were priority group 4, which we would class as, you know, really vulnerable, a lot of health long-term conditions, and when they come in you think these are very vulnerable. But if we just have to emphasize the point that care staff are in priority risk 1, they come 1, yes, not 4. And these are the people that we really, really need to be vaccinated because of how vulnerable and high risk they are. And if there's anything we can do to make care workers understand that they're priority risk 1, it's so important for them to be vaccinated to help themselves, you know, to prevent COVID. And if you look at the data that's coming out, 88% of deaths have been in this high risk group, priority 1 and 2. So I don't know how we're going to get the message across to care workers of how important it is to have a vaccination just because of the high risk group they're in, priority 1, not 4, you know, 1. So anything we can do within little subgroups, as David was saying, that we could get together to emphasize this point of how important it is to be vaccinated.
Thank you so much, Irene, and that's an excellent point. Excellent. And I have got Lindsay. Do come in, Lindsay.
Hi, I'd like to go back to something that Steve said. The staff who adamantly refuse, moving forward, will that affect care providers in terms of their CQC rating as safe? At the moment, nothing we can do. There's absolutely nothing we can do to enforce a vaccination. We can't, as he said rightly so, employ and recruit and use that as a league, because that is illegal to do that. You can't discriminate against somebody who refuses to have one. However, will we as an industry be penalised for that by CQC, Norfolk County Council, Infection Control, whoever?
Let me bring in, yeah, let me bring in Tim. Sorry, Tim, to bring you in.
No, that's fine. No, you caught my eye there.
I caught your eye.
You could see me wanting to go edge into that. So I mean, I can't speak on behalf of the regulator, obviously, but the conversations that we have with CQC, which we have very frequently, is that they won't take enforcement action. They won't penalise you in respect of, say, for any of the other domains, in respect of work that you're doing flat out to try and encourage all of your staff to be vaccinated. We know that you're doing that, and they know that you're doing that as well, so they can't penalise you more so because there's no specific regulation that requires you to do something that isn't mandated in law anyway. So you know, they'll recognise that, you know, you're making your best efforts to ensure that the services you operate are as safe as they can be, given that people have that right to exercise that opportunity not to take up a vaccine, and ultimately they may not, you know, in spite of your best endeavours to encourage them to do so. So that's one. Well, I can speak on behalf of the council, so that's easy. And certainly from a QA perspective, of course, we're not going to penalise any provider because we can see exactly what you're doing to encourage people. So no is the answer to that. It's a really simple one from my point of view. And in conversations that we have regularly with CQC will be along that vein. If they ever change their mind in that on that position, then we will let you know. I don't think they will. I don't think they will.
Thank you.
I hope that reassures you a little bit. Lindsay, I'm so sorry, but we have come to 11:30. There is a question that was in the chat box. Are we happy just to answer this one last question I'm sorry for people with their hands up, but if you want to just put some other questions or notes in the chat box, that's fine. But can I just take this last question, if everybody's okay, just to stay for this one, which is from Victoria. She says, with vaccinations, we had an outbreak and a lot of carers' households have also been at higher risk due to their partners having this. Have they been considered to be higher up the list for vaccines? Victoria, can you come in and just explain that to us a little more?
A lot of our staff have tested positive, and we've had some staff members' partners, they've been on a CPAP machine, they've had double pneumonia. Like, because we've brought it home to them, their partners have also tested positive and been in hospital with it as well.
So I'm now frightened to work.
Right. Is there anyone that could answer that question? I don't know. Irene, are you still around on the call? I'm so sorry, I can't see you. Has Irene left?
Sorry,
lovely, Irene. Are you able to answer that one?
I don't know if they're being called as a high risk group, because we have really been, I mean, everybody has been following the guidelines priority to 9. You know, within PCNs, and I'm sure Janine will agree that the call out has been per risk group and per age group, and the same with booking in. So I'm not sure if it has been identified and if they can at this point, but it is something that we could discuss. And also when they're maybe being contacted by their PCNs, it is something they could raise about households. But I don't think we have covered this in our priority groups.
No, I mean, the priority groups now are 5 and 6.
Yeah.
5 is obviously for those with underlying health conditions. Now, if they fit into that category, they should be contacted. Beyond that, they are following the rollout categories, the cohort groups as defined in the guidance, and they are not diverging from that. Janine, did you want to add anything?
Yeah, this is it's a terrible problem. Also, with a lot of people who work in healthcare, they've taken COVID home. Teachers are and will continue to take COVID home, and this is an issue. So what my hope is that we are really vaccinating everyone at pace. So I'm hoping that really by the summer we'll get everyone who's an adult jabbed, and but I'm pretty sure that they're not in any categories, unfortunately. Household members of care staff, teachers, frontline workers are not in any of the categories, I'm afraid.
Thank you.
Thank you, and thank you for raising that. It's a really important question. Thank you. I'm going to call the session to an end now, but I'd like to thank all the people that have attended from Public Health. Janine, thank you so much for attending. That's been fantastic. Louise has had to go, but it's been great having Louise here, and Suzanne as well. Thank you as always, Tim, Irene. Thank you, Angela, as well, and David for coming along to support with this session today.